Hello everybody and welcome. My name is Nicole Keller and I am the Employee Benefits Supervisor for Los Rios. Today we're going to be talking about open enrollment. So first I'll be giving a brief introduction about open enrollment as it pertains to our Employee Benefits Department, and then we'll actually be hearing from each of the carriers who are with us today. For those of you who are at Folsom Lake College today and are live, you'll actually be able to go and meet with each of the vendors in another room on campus. But for now, I'm going to go ahead and get started. We'll dive into everything open enrollment. First off, by now, you should have received your open enrollment memo that was delivered to all campuses, and those are employee specific. They're actually specific by bargaining unit. So the memo would have went to your mailbox on campus, and then enclosed within that was also an employee benefit guide, which is a very detailed guide that outlines all of the benefits that are available to you as a Los Rios employee. So you'll want to read that guide really thoroughly. There's a lot of important information. The memo highlights some of the big changes that have happened during this open enrollment period for fiscal year 2018-19, but the benefit guide provides a lot further detail on all the benefits that we offer. And so a common question that we receive in our office is, do I need to do anything if I'm not making any changes? If you're not making any changes during this open enrollment period, you won't need to do anything, but we do strongly advise that you still read the employee benefit guide so that you can pick up on all of that important information. If you are making a change, there are certain documents that you'll need to complete, and it depends upon the type of change that you're making. So for example, if you are enrolling in a new plan or adding a dependent, you'll want to complete the enrollment change form for the particular plan that you're enrolling in. You'll also want to complete a payroll deduction form, which basically gives Los Rios authorization to take the premium from your check in the form of a payroll deduction. Some other changes that you may be making could be if you may be adding a spouse or a domestic partner. If that's the case, you will want to also provide a copy of your marriage license or marriage certificate at the time of enrollment, as well as if it was a domestic partner that you'll be adding, you'll want to provide the affidavit of domestic partnership. If you're dropping a dependent during the open enrollment period, you will simply need to complete the enrollment and change form for each plan that the dependent is currently enrolled in. If you're canceling coverage, it's very important that you complete a cancellation form, whether that pertains to medical or dental. In addition, you'll also want to complete the medical plan waiver form. If you are waiving coverage, in addition to canceling the coverage, you'll want to complete the medical plan waiver form. It's imperative that original forms are submitted to the Employee Benefits Department. We cannot receive fax copies, emailed copies, anything aside from the actual original forms, meaning original with signature included. Best ways of providing those to our office would be either by inter-campus mail. You can mail them to our office, or you can drop them by. We do recommend that you drop them by in person if possible, so that we are able to, on the spot, provide you with copies, the stamped copies, showing the date that you enrolled. And that's basically your proof, your documentation that you did so. So for this open enrollment period, those forms must be received in the Employee Benefits Department by the end of the period, which this year, the last day of open enrollment is Friday, May 25th, and it closes at 5 o'clock p.m. sharp. So please make sure that all documents are submitted before 5 o'clock p.m. on Friday, May 25th. Unfortunately, if they're not submitted by that deadline, your next opportunity to enroll would be during the next open enrollment period, which will be spring of 2019 with the July 1st, 2019 effective date. Again, postmarks, scanned forms, and placement in campus mail do not count as meeting the deadline. If we receive them in any capacity after that deadline, unfortunately, you will not be able to enroll. One exception to that would be if you go through what's called a mid-year qualifying event. If you experience some sort of mid-year qualifying event, it may afford you the opportunity to enroll. It's dependent upon the situation. So for further detail, you would want to contact the Employee Benefits Department, and we could give you more information about whether or not your event would coincide with that sort of enrollment. Outside of open enrollment, New hires have 31 days from the date of hire to enroll. Adjunct faculty have two different enrollment periods. They have a fall and a spring enrollment period. This year, the fall enrollment period closes at 5 o'clock on August 23rd. And for next year's spring enrollment period for 19, it will close at 5 o'clock on February 11th. Again, late forms are not accepted. So open enrollment changes take effect July 1st of each year. The plan year goes from July 1st of 2018 to June 30th of 2019. For new hires, when they enroll, benefits are effective the first day of the month following their date of hire. The one exception to that is if they are hired on the first working day of the month, their benefits actually begin that month in which they're hired. And for adjunct faculty, benefits begin on either September 1st or March 1st, depending upon the enrollment period that they're enrolling in. So for 2018-19, the district contribution, it varies by bargaining unit. So for LRCFT, the current district contribution for 2018-19 is $1260.85 per month. For LRCEA, it's $1130.16 per month. SCIU, it's $1233.63 per month. And for confidential employees, supervisors, and managers, it's $1212.51 on a monthly basis. Now, for part-time employees with less than 0.5 FTE, they receive a prorated district contribution. The way that you can compute that is basically to take your FTE times the full district contribution, and that would provide you with the prorated amount. Same goes for adjunct faculty. The district contribution is prorated if your contribution is less than 0.60 FTE. And so the same would apply. You would take your FTE over 0.6 multiplied by the full district contribution amount for your bargaining unit. And that's how you would compute your district contribution. Our rates are composite, and that means that the rate that you pay for a medical plan, for medical or dental insurance, does not cover despite the number of dependents that you're covering. So in other words, whether you are requesting single coverage, employee plus one, employee plus two, etc., the rate that you pay on a monthly basis, or your monthly premium, does not change. It's also considered an evergreen election, and what that means is your coverage in effect will remain in effect from year to year unless you make changes to it. You can't make any changes after an election is made during the year unless you may experience some sort of qualifying event. For example, you lose other coverage, add a newborn, or etc. You would have to make those changes within 31 days of the qualifying event. And so before we move on, I'll just provide a few brief definitions that will be helpful for you to know when selecting a medical plan. An HMO is a health maintenance organization. It's basically an organization that provides health insurance with providers under a contract. Those providers direct patient care. That would be somewhat of the traditional model that many people are used to hearing about. A copay is a fixed amount that you're paying for a covered service at the time of the service. The amount varies depending upon the service and also the plan that you're enrolled in. A deductible is the amount that you owe for various covered services before your health insurance begins to pay for the service. So with deductible plans, you would basically have to meet the deductible or pay the entire deductible prior to the health plan actually picking up costs. There are some exceptions to that, and you'll want to take a look specifically at the plan that you're enrolling in for more details. An out-of-pocket maximum is the most that you would pay during a policy period. So for us, it would be on a calendar year basis, and that's the most you would pay before your health plan actually starts to kick in and pay 100% for covered services. The limit has to include deductibles, coinsurance, and copayments. Coinsurance is your share of the cost of a covered healthcare or dental service calculated as a percentage. For example, you may pay 20% of a service, and the insurance may pay 80%. A high deductible health plan, which we'll be talking more about later in the presentation, is a medical plan that not only has a high deductible, but it has to conform to certain established federal guidelines as well. A health savings account, which often coincides with a high deductible health plan or an HDHP, is a tax-deductible savings account that's used in conjunction with an HSA-qualified high-deductible health plan. So again, we'll talk more on that. Those can be a little bit confusing, and we'll hope to sort that out as we go forward. We actually now have HSA options with each of our carriers. So Kaiser, Sutter Health Plus, and Western Health Advantage all offer those kinds of plans. Okay, so that wraps up the employee benefits portion for now. Now we're actually going to hear from Kaiser.
Good afternoon. My name is Siobhan Bettis. I'm with Kaiser Permanente. We are happy to be here to present your plan options for you. So to get started, we will go through really what Kaiser offers to you. So at Kaiser Permanente, we do try and be a partner with you when it comes to your health care. With that being said, you are able to pick and choose your doctors and your facilities that you are utilizing within the Kaiser Permanente system. You are able to go online at kp.org/search doctors, and all of the open doctors that have open panels and are accepting new patients will come up. Again, we do want you to be comfortable with your provider, which means that you are able to change your doctor at any point in time. You do not have to wait for that change to go into effect. Another thing that we do offer is the ability for you to choose how you are going to use your health care. So we do want to make it convenient for you as well as easy for you to receive the care that you need. And with this being said, we do allow you to choose which option or which avenue you're going to access that care. That gives you the ability to either see your doctor face-to-face for your services. You can also choose to do a video visit or a telephone visit, or email your doctor. I personally love to email my doctor first and then let my doctor let me know if I need to actually come in for services at a facility. You also have the advice line that's available to you. So the nurses are available 24 hours a day, 7 days a week. They are able to triage you. One of the nice things about our advice nurses is the fact that they are able to see our full scheduling system. So if you do need to make an appointment to see a provider after speaking to the advice nurse, they can go ahead and take care of that right then and there for you. Technology is also changing, it's always evolving and always changing. So you do have some online and mobile capabilities. You are able to register online at kp.org. It gives you our full website, which has health and wellness resources. It also allows you to schedule your appointments, reschedule, manage prescriptions, view lab results. But you also have the ability to access some of that information or those services through the mobile app. So the mobile app is available to any Apple or Android users. It's a free app. You do not have to re-register for the app if you are already registered online. It's the same login information, but you're able to schedule your appointments, reschedule, cancel. You're able to view your lab results. You are also able to manage other members of your family. So if you have children, I'm able to do all of those functionalities for my child as well through the app. We do have a travel department that is available to you. So if you are traveling abroad or outside of the Kaiser Permanente service area, you can reach out to the travel line. They can provide you information on any immunizations that are required for your travel, as well as they are available 24 hours a day, 7 days a week. If you happen to be traveling and find yourself in need of some advice as far as your health needs go. So we do have a number that is listed, as well as kp.org/travel that you're able to get that additional information. Healthy resources are available to you at no cost as well. So we do have a plethora of healthy resources that you are able to take advantage of. We have wellness coaches that are available at no cost to you, as well as healthy lifestyle programs. So if you've ever needed a little help implementing an exercise plan or eating a little bit healthier, maybe you're going through a stressful time in your life right now, we have some of those programs that can help you work through that. We also have, again, a plethora of information on the website, so you are able to go to kp.org. You would go to the Health and Wellness tab to find that information. Moving on, we're going to go ahead and talk about your actual benefits that you have available to you. So you have 2 plans that have been available and 1 plan that is a new plan that we'll talk about lastly. The first plan is the traditional Kaiser HMO plan. This is a plan that is strictly a co-payment plan. So you'll notice it does not have an annual deductible. You're only paying co-pays for your services. Your preventive care is covered at 100%. So if you go in for that annual physical, you're not paying even a co-pay out of your pocket. Your office visits outside of your preventive care are going to have a $15 co-pay. Your lab and x-ray, your standard diagnostic lab and x-ray is covered at no cost to you. Outpatient surgery has a $15 co-pay. Hospitalization is covered in full. If you do have to take a trip to the emergency room, you will have a $100 copay per visit, but it will cover everything that happens during that emergency room visit. You also have prescription copays down at the bottom. So these copays that are listed are for a 30-day supply. It's a $10 copay for generic prescriptions. And then if you are picking up a brand name prescription, it would be a $20 copay. If you do take specialty medication, it's a 10% copay that you are responsible for. And keep in mind that all of these copays and that 10% percentage that you are responsible for do count towards that out-of-pocket maximum that's listed. So it's a $1,500 out-of-pocket maximum per covered person on the plan. And if you have family coverage, it would not exceed $3,000 between everyone in the family. At that point, if you do happen to reach that out-of-pocket maximum, the plan does kick in and it will start covering all of your covered services or covered benefits at 100% for the rest of that calendar year. Okay. The second plan is the Kaiser Deductible HMO, or the DHMO. You'll notice on this plan you do have a copay, a deductible, which is a $500 deductible per individual on the plan. If you have family coverage, it would not exceed $1,000 between everyone in the family. Your out-of-pocket maximum is $3,000 per individual. If you have family coverage, it would not exceed $6,000 between everyone in the family. Again, your preventive care is covered at 100% on this plan. Your office visits, as well as your standard diagnostic lab and x-ray. I'm going to go back. Your office visits are a $10 copay, and your deductible does not apply. Your standard diagnostic lab and x-ray is covered with a $10 copay. This is after your deductible. So do keep in mind, if you go in for lab testing and you have not met that deductible, you will not pay that $10 copay. You are going to pay the full cost of that lab test until your deductible has been met. Once that deductible is met, then you would pay that $10 when you go in for lab and x-ray services. Your outpatient surgery, your hospitalization, as well as your emergency care are also subject to that annual deductible. So again, you will pay the full cost of services until that deductible has been met. And then after that deductible has been met, that is when your responsibility drops down to 10% of those charges. Prescription medications are down at the bottom. So a $10 copay for generic medications, a $30 copay for brand name medications, and then that 10% for any specialty medications. Again, keep in mind all of the costs that you are paying out of pocket, that copay, that deductible, as well as that 10%, all count towards your out-of-pocket maximum. So again, that is kind of your worst case scenario for the year, is that out-of-pocket maximum. The new plan that you have available to you is the Kaiser High Deductible Health Plan, or HDHP. This plan is a little bit different. You'll notice at the top it does have a higher annual deductible. So you have an $1,800 deductible if you have individual coverage. If you have family coverage, your deductible is $3,600. Your out-of-pocket maximum is $3,600 if you have single coverage, and if you have family coverage, the maximum is $7,200. With this plan, you also have preventive care services that are covered at 100%. However, anything outside of your preventive care services will be subject to that deductible. So if I am on this high deductible health plan and I go in to see my physician because I'm sick, maybe I feel like I have a sinus infection, I'm going to pay the full cost of that visit, and that amount will count towards my deductible. If I then have to go and pick up a prescription at the pharmacy, I will pay the full cost of that prescription, and that amount will also count towards my deductible. I will continue to pay for my services if I am using them throughout the year. Again, if I hit my out-of-pocket maximum for the year, then the plan will kick in and start covering all of my services at 100% through the end of that calendar year. There is also a HSA component that you can utilize with this plan, which we'll get touched on a little bit later, but it does help offset some of those costs for this plan. Just a little refresher on what you can expect if you are a new member within Kaiser. So you do have the welcome site. It's kp.org/new members. You can access that at any point in time. Within the first 10 days of being enrolled, what you can expect is to receive some mailing from us, as well as a phone call welcoming you to Kaiser and answering any questions that you may have. So you will start in receiving your ID card, as well as a quick guide to how to access Kaiser and how to utilize Kaiser Permanente, as well as a personalized welcome book that will go over your specific benefits, as well as that welcome call. You will, after you choose your doctor, which we give you 60 days to choose your doctor, if you do not choose your doctor within those 60 days, we will auto-assign you to someone. However, as we mentioned, you are able to change that at any point in time. But once you do have a doctor, you will receive also a welcome letter from your physician. I know that was quick information, but I do thank you for taking the time to tune in to this broadcast. Thank you.
Hi, good afternoon. My name is Stacy Clapsaddle. I'm an account manager with Sutter Health Plus, and I'm very happy to be here with you today. And I would like to thank the district for having us back again this year as a partner for your health plan benefits. So to get started, Sutter Health Plus is a relatively new health plan. We are an affiliate of Sutter Health. We rolled out the health plan about 4 years ago. We are growing very quickly. We are a regional health plan located in Northern California. We currently have over 7,000 providers, 30 hospitals, and we are now in 15 counties. So Sutter Health Plus contracts with affiliated medical groups and hospitals. And in the Sacramento Valley area, including El Dorado, Placer, Sacramento, Sutter, and Yolo counties, our affiliated medical groups are Sutter Independent Physicians, Sutter Medical Group, and Sutter Medical Group Solano. And our affiliated hospitals are Sutter Auburn Faith Hospital, Sutter Davis, Sutter Medical Center Sacramento, Sutter Roseville Medical Center, and Sutter Solano Medical Center. So as our traditional HMO, when you enroll with Sutter Health Plus, you'll select a primary care physician. And to assist you in doing that, we would like to direct you to our website, which is sutterhealthplus.org/provider search. And right there you can search for your primary care physicians, for your specialists, hospitals and urgent care facilities, walk-in care, behavioral health providers, and pharmacy benefits. You would just simply put in your zip code, select in the drop-down the provider type that you're looking for, and hit search, and a list will come up of participating or contracted physicians and facilities. So as an HMO, the primary care physician will manage most of your services, meaning that if you need to see a specialist or have lab work done, your primary care physician will issue a referral to that specialist or for your lab work within that physician's medical group. Now, the medical group must give prior authorization for a member to see a provider or obtain services and supplies from a provider outside of the medical group's network. So we have a little flow chart here that helps understand your medical group. So your primary care physician will refer you for a lot of things, but not all. So for instance, to a specialist, you would need a referral for lab work, for diagnostic imaging, for rehab services. But there's a lot of services where you do not require a referral. So for instance, if you were to contact our 24/7 nurse advice line, if you can self-refer to an OBGYN, as long as that specialist is in the same medical group as your primary care physician. No referral needed for health coaching. There's no referral needed for behavioral health. So if you feel like you would like to obtain behavioral health services, you would simply go to our website and search for a provider, and you can make contact yourself without going through your primary care physician. No referral needed for walk-in care, urgent care, or emergency services. So I'd like to take just a couple of minutes now and go through the benefit offerings for your group. So the first plan I want to talk about is the traditional HMO copay plan. Now this plan has no deductible. The maximum out of pocket for an individual in a calendar year is $1,500, and for a family it's $3,000. So what that means, the out of pocket, is that's your maximum liability in a calendar year. If you were to be very ill or injured, that would be the maximum that you are responsible for in that calendar year. After that, the health plan would then kick in and cover the rest of the services. The primary care office visit and a specialty visit is a $15 copay. For outpatient services, for the outpatient surgery facility fee is $15 copay. There's no charge for diagnostic and therapeutic x-rays and imaging. For imaging, meaning CT, PET scans, or MRIs, it's a $15 copay per procedure, and no charge for laboratory tests for non-preventive. Oops, excuse me. For hospitalization services, there is no charge, a $35 copay per visit for ER, and a $15 copay for urgent care. And for behavioral health, it's a $15 copay for an individual appointment, or for a group appointment, it's a $7 copay. And again, all preventive care services are covered at 100%. For your prescription drugs, Tier 1 is a $10 copay, $20 copay for Tier 2, $35 copay for Tier 3, And for Tier 4, which is usually your specialty drugs, it's a 20% coinsurance not to exceed $100. Specialty drugs usually require a prior authorization. And then we do have our mail order prescription service, where you would have just double the copay, but for a 90-day supply instead of a 30-day supply. We're also offering a second plan. It's a high deductible health plan. And this plan works a little bit differently than a traditional copay plan. So the out-of-pocket maximum for this plan for an individual is $3,000, and for a family it's $6,000. And the deductible is $1,500 for an individual, and this $2,700, that refers to an individual within a family unit. And I'll explain a little bit more about that in a minute. And the family deductible is $3,000. So the way that this plan operates is, because it's a high deductible health plan that is compatible with a health savings account, the member is responsible for all services until the deductible is satisfied. So for instance, if you need to go see the doctor because you think you have a cold, you will be responsible for the entire amount of that doctor visit. And then afterwards, if you need to go get a prescription, you'll be responsible for the entire amount of the prescription until the deductible is satisfied. Now, unless you have preventive care services, of course, there is no cost to you for preventive care services. Now, the deductible for a family, if you have a minimum of 2 people, it's considered a family. And if one person, one individual within that family satisfies that $2,700, then they automatically will move forward, in that they no longer have to pay for their services. The health plan at that point will cover the services at 100%. Which is really great. You know, in the old days, it used to be where if one member would have to satisfy the entire family deductible. It's not that way anymore. So it's a $2,700 individual for a family deductible, and then the health plan will continue to pay after that. So for professional services, primary care office visit, and the outpatient services, once the deductible is satisfied, there is no charge to the member. There is a $50 copay per admission for hospitalization services after the deductible is satisfied. That's the only copay charge, the only charge in this plan that would need to be satisfied after the deductible has been met. Again, no charge after the deductible for ER and urgent care services or for behavioral health services. And the same for prescriptions. Once that deductible is satisfied, there is no charge. So our pharmacy plan partner is MedImpact. We have mail order available through Postal Prescription Services. Our specialty pharmacy is through Alliance RX Walgreens Prime. And we also have a MedImpact member portal that's available to you, which you can access through the Sutter Health Plus website. You can go there to find a network pharmacy, compare drug prices, and you can also search the Sutter Health Plus formulary. So if you are interested in perhaps moving from your current health plan to Sutter Health Plus, perhaps you're taking a number of medications, that might be a helpful piece of information to know. Is your prescription part of the Sutter Health Plus formulary? You do not have to be a member to access that. You can go directly to our website, click pharmacy, click formulary. You'll have the entire formulary available to you. And this is just a screenshot of what the pharmacy locator looks like on the MedImpact portal. From there, again, you can search for pharmacies. You can look at the formulary. You can compare drug prices as well. You don't have to be a member to do that. MedImpact contracts with many, many major pharmacies throughout the U.S. Target, Walgreens, Walmart, Rite Aid. Very convenient. When you do your shopping, you can drop off your prescription or have your doctor call it in and pick it up while you're doing your shopping. Our behavioral health partner is through U.S. Behavioral Health Plan of California. They provide mental health, behavioral health, and substance abuse disorder treatment services. Members do not need a referral to obtain these services. And what members would need to do is go to our website, sutterhealthplus.org/provider search. It will take you to the U.S. Behavioral Health site where you would click on the provider search, enter your zip code, and a list of providers would come up. If you don't feel like you want to go through the possible hassle of looking up a provider, you can always call Behavioral Health Services directly. They are very helpful and can assist you in finding a provider in your area. They can even assist with scheduling an appointment. Sutter Health Plus has rolled out some very nice walk-in clinics in this last year. They're convenient clinics. It's a little bit different from urgent care. If you're just feeling under the weather, maybe you feel like you're coming down with a cold, maybe you have an interesting rash you woke up with in the morning, your son needs a sports physical, oh my gosh, it was due tomorrow, I have to get it done. Perfect ideas to go to the walk-in care. You do not need to schedule an appointment. You can just go in. They're beautiful clinics. It doesn't even feel like you're in a clinical setting. They're very nice facilities. We have our nurse practitioners there at the walk-in care. The same day visits are the same as your copay that you would pay to go into the walk-in clinic. We also have video visits available now through the walk-in care, and not just for the Sutter Medical Foundation members, but in a minute I'm going to talk about My Health Online. You can go on to My Health Online and you can schedule a video visit with any of our nurse practitioners at the walk-in clinics. They're open 7 days a week from 8 a.m. to 8 p.m. and our current locations right now are in Citrus Heights, Dublin, El Dorado Hills, Elk Grove, in Petaluma, Roseville, San Francisco, San Jose, San Ramon, and Walnut Creek. So urgent and emergent care. Members can access emergency and urgent care when they need it from any facility in or out of the Sutter Health Plus network without a referral. Sutter Health Plus covers emergency services and urgent care worldwide, and you can find a list of our urgent care locations on our website. For those of you who may have college students that are enrolled on the plan, they live outside of the service area. Important to know that if they need urgent care or emergency services, they can be seen. They can be treated and it would be covered under your plan benefit. However, if they need follow-up care, if they have any ongoing health issues that require seeing a physician on a regular basis, that all needs to take place in the service area with their primary care physician. So I like to encourage to think twice about that. If you have a student that's away from here that has a chronic condition, you may want to take a look at other insurance options provided through the school at that time. Otherwise, again, urgent and emergency care are covered for the one initial visit only. Any follow-up care, the student would need to come back into the service area. Sutter Health Plus has a member portal that allows you to view, print, or request a member ID card. You can change your primary care physician at any time. You can also view your eligibility, your co-pays, and your account balances. So for instance, if you're on the high deductible health plan and you're wondering how much of my deductible have I satisfied, you can go to the member portal and you can see your accumulation. You can also update your personal information on the member portal. And Sutter members also have access to My Health Online, which I spoke about just a minute ago. My Health Online is how you communicate with your Sutter doctor. So you can schedule a visit, you can email your doctor, you can view your lab tests. If you have any questions about your lab work, I do all the time. I will email my doctor and want further clarification. They can email you back. You can access your medical records. You can pay your co-pays online through My Health Online. We also have a health and wellness site for our members. We have health coaching programs for healthy weight management, tobacco cessation. Maybe you're finally ready to give up smoking. We have support for that. Stress management. We have disease management programs at no cost to you for asthma, heart failure, diabetes, high blood pressure, high cholesterol. We have a health and wellness site that includes a personal health assessment that you can access through the member portal. It has 12 action plan modules that then connects you with one of our coaches to help you keep on track and obtain your goals. And then we have our 24/7 nurse advice line. At any time, you can call the nurse, If you're wondering, what do I do? It's the middle of the night. Do I go to the ER? Do I wait to get into the doctor? The nurse has your records in front of her or him and can give you the advice that you need at that time. If you're moving over to Sutter Health Plus, perhaps from your spouse's plan or from a current plan, we're on the same medical record system as Kaiser Permanente, UC Davis Medical Group, UC San Francisco Health, John Muir Health, and Stanford. So it's a seamless transition. Your medical records are on the Epic system, and it'll move directly over to your new primary care physician. If you are with any other group, Brown and Toland, Affinity Medical Group, or Dignity, you may need to request a medical records release form to provide to your primary care provider. And for transferring prescriptions, we recommend that you should refill your available prescriptions and get a written prescription before your effective date, just so that you don't have any lapse without your medication. And then after your effective date, you should refill your prescriptions through a MedImpact Network pharmacy, or consider the prescription postal service if you're on maintenance medications that you take monthly. New members will receive a new ID card within a few days of enrolling or of the plan effective date. They'll get a welcome book that contains a lot of important information on how to work with Sutter Health Plus. And you'll also get a personal phone call from a member of our member services team just to check in and answer any questions that you have about the plan benefits. They can help you coordinate your first appointment with your primary care physician. And if you're renewing with us, you will get a postcard in the mail thanking you for coming back, reminding you of the different services that you can obtain with Sutter Health Plus. And renewing members do not receive a new ID card, so you don't have to wait for one in the mail unless you've had a change in your primary care physician. And you can always call Sutter Health Plus Member Services if you have any questions about your plan. And even if you're a prospective member, you're not sure yet about Sutter Health Plus, you can call Member Services and you'll get routed to the correct department to answer your questions. Thank you very much for your time.
Hello and thank you for your time today. My name is Brian Christie. I'm the sales manager with Western Health Advantage. I'm excited to be here to talk about Western Health Advantage for the Los Rios employees because I feel passionate about who our company is and what we do, what we mean locally here to the Sacramento community and the surrounding counties that we service. I mention local because we truly are a local company. We keep our footprint within the Northern California region so that we can truly serve the counties that we live in and that we can understand the network that we are presenting, and we know best what is right for our members within those geographic regions. We're different though. We are a local carrier that specifically contracts with medical groups. We were created through a coalition of doctors that got together and determined insurance is too confusing and there's a middleman taking too much of the premium and not concerned with the care that the members are receiving. So through this partnership, our medical groups, local medical groups, UC Davis, Mercy Medical Group, and UC Davis, Mercy Medical Group, and North Bay Physicians came together to create a partnership. North Bay Health Systems as well as Mercy are the owners and operators of our company at this point. What is great to understand about it, they are focused on the care that our members are receiving. The care that our members receive is truly between their doctor and their medical group without WHA in the middle determining what is right or wrong for a member. It's refreshing to have a doctor make a medical determination for a member rather than an insurance company. We're a local nonprofit, which also means that the money that your employer and you are paying to have these benefits truly is going into the care that you are receiving. Ultimately, the result is a health plan that's committed to offering clear value, quality coverage for businesses and individuals here locally. We've been operating this model for over 22 years now, and with just over 130,000 members, it has been a great success at maintaining affordable, robust coverage that meets the needs of you and your loved ones locally. So for the Sacramento marketplace here, we're utilizing the Mercy Medical System of hospitals. In addition, we have the Mercy Medical Group, Hill Physicians Medical Group, and Woodland Healthcare. As you expand further throughout the 80 corridor and into other parts of Northern California, we have the North Bay Healthcare Medical Network, as well as St. Joseph's Health, Hill Physicians on into the Bay Area, Meritage Medical Network throughout the Northern Bay Area, UCSF Health, as well as John Muir Health. And these are new additions to our plan effective January 1st. So these are exciting changes that give you, the WHA members, additional choice and flexibility in the care that you will receive through our network. The hospital systems cover just over 13 counties currently, with additional expansions further planned that will give our members access to even more. In total, it's just under 30 hospitals. Now, why this matters to you as a member of WHA is exactly why we were started, to give flexibility, choice, and freedom. WHA has a program called the Advantage Referral Program, and the intention of this is to give members access to the full network of medical groups and service providers that we offer. The Advantage Referral, if you were to compare a normal HMO, the goal is to keep you in one medical group and ensure that all of your care is received under that one umbrella of that doctor's group. With WHA, you have the flexibility to seek specialty care throughout our entire network of medical groups and hospitals. So even though you love your primary care doctor, maybe you want to get a specialty referral to UCSF and you want to get a second opinion for specialty services. The Advantage Referral opens that door to you while maintaining the doctor relationship that you have here locally. As I mentioned, we have just under 30 hospitals currently within our network, and with more coming online later on this year under our new Canopy Health expansion within the Bay Area. Now, another thing that's really great and different about WHA, about when we leave the care to the doctor that's caring for you and your loved ones, it also ensures that they work the relationship, that they own that access to you, and that they are looking out for your best interest within this managed care system and product. Within that idea, you always want to work with your primary medical group to figure out if you require access to care after hours. If you can't get into your primary care, we encourage you to always start with your medical group or with your primary care officer. There is going to be after-hours doctors on call, as well as nursing staff on call any hour of the day, so that they can help you make the appropriate medical decision for you or your loved ones, whether it's going to the emergency room, seeing an after-hours doctor that has the clinic open, or finding an urgent care center. Your medical professional or your primary medical group is going to help you make that call. And it's important because they house your entire medical record and they have your history in mind when they're making a recommendation for your services. Los Rios has selected two very rich plans in benefit and quality and in access within WHA. So I'm going to go through a brief overview of these benefits so that you have an understanding of how to select the right plan for you and your family. Our primary plan is going to be a similar or a traditional HMO plan. This plan is called our Premier 15. This plan has no deductibles, so that means that you do not have to worry about a first dollar amount you have to meet before the plan kicks in. This plan has an out-of-pocket limit of $1,500 annually as an individual, or a combination of up to $2,500 as a family. It is difficult on this type of plan to actually hit those out-of-pockets because the benefits are so rich in nature. So on your day-to-day, you're simply going to have a $15 copayment whenever you go to your doctor, specialist. Any and all lab work that they order is going to be covered in full under that $15 visit. What is very rich about this plan is going to be the hospitalization. If you or a loved one has a stay in the hospital, you are looking at 100% coverage, meaning you do not have any cost sharing for that stay in the hospital. If you do go to the emergency room, you have a $100 copayment. If they admit you into the hospital, they waive that copayment, and ultimately it goes into that 100% bucket where you're not even paying a copayment whatsoever. Urgent care centers are covered at a flat $20 copayment. We encourage members to utilize some of the urgent care centers within the Sacramento region if you require after-hours care. We contract with a number of different networks, with more coming online currently. If you go to mywha.com, you'll be able to locate any urgent care center that's closest to your home. And finally, the chiropractic and acupuncture benefit that's associated with this. You have up to 20 visits of chiro and up to 20 visits of acupuncture. Now, both of the plans I'm going to talk about today also include the Affordable Care Act mandated preventive health services. These are covered at no cost to you. So we encourage everybody, take advantage of these, get your physicals, get your wellness exams. You will not even have an office visit copayment. Do understand when you're going into these visits, it's important to point it out to your physician, I'm here for a physical, I'm here for this wellness visit. If they do see you for a physical and they assess you for anything else in that visit, so you tell them about a lot of pains in your arm, they are entitled to bill you for a service. So it's really important to understand why you're in there up front and speak correctly with the doctor so that you don't get a surprise in the mail of a copayment because they billed for a traditional visit. Now, your prescription drug benefit is a 3-tier formulary. That means that you have a generic tier, you have a brand name drug tier, and then you have a non-preferred brand name tier. To understand this, it's because WHA does not make the decision of what is the best drug to treat you. We leave it to our doctors to make the right choice for their members and what is medically necessary. So if you're taking a generic drug, you're going to have a $10 copayment for a 30-day supply. If you're taking a brand name drug, it has a $30 copayment. If you're taking one of those drugs that is not as common or is highly overpriced for some reason or another, because there's a lot of drugs on the market, it may fall into that third tier, which is the non-preferred brand, but you still access it at a flat $50 copayment. You're also able to utilize our mail order system, which gives you a 3-month supply of that drug at 2.5 copayments. Now, injectable medications, these actually fall under our medical benefit. So they actually do not fall under the prescription drug benefit. They would have a 20% copayment to a maximum of $100 monthly for a 30-day supply. The alternative plan that's being offered by Los Rios is called our Western 1800/0. This is a high deductible health plan, also referred to as an HSA eligible plan. What it is it's a high deductible plan that is coupled with a financial piece, which will be discussed later, in the financial piece being a savings account that can be used to pay for the services you receive. On the Western 1800/0 plan, you as an individual have an annual deductible of $1,800. That means that all of the care that you're receiving throughout the year, whether it's going to an office visit, picking up a prescription drug, or a hospitalization, you will be charged the contracted rate, the full contracted rate for that visit until you hit your deductible. After you hit your deductible, you have a limit in place that protects you from being charged anything more. Ultimately, for all your medical care services, it would be covered at 100% after your deductible's been met. So, as an individual, you have an $1,800 deductible. As a family, you would have a $3,600 deductible. But as an individual that is within a family, you will not be subject to anything more than an embedded deductible of $2,700. So that means that if it's you, your spouse, and a child, and you're the one who has a major medical event occur, the most bill you will receive for that medical event is going to be $2,700, after which point all of your care is covered at 100% with no cost sharing. The only caveat or exception to that is going to be after your deductible, you will have a copayment for your brand name drugs and your non-preferred brand name drugs. The copayment will be $30 for brand name, and it would be $50 for your non-preferred brand name drugs. That copayment only applies until you've hit your out-of-pocket maximum. So do understand that for the very most part, your plan is going to be covering you at 100%, except for those monthly drugs if you're taking a non-generic drug. Here's a slide to cover your actual, how the pharmacy benefit works. On the 1800 plan, as I mentioned, everything applies to the deductible. So up until you hit your deductible, you'll have a zero, you will have the full cost of the drug. After you've hit your deductible, you'll see the $30 copayment or the $50 copayment that would apply. You're also able to utilize the mail order system for those brand name and non-preferred brand name drugs, and it would be a 2.5 copayment. On this plan, the injectable medication still does apply to your medical benefit. The difference being that after your deductible has been met, those injectable medications are covered at 100%. And self-injectable medications are considered specialty meds that you would get from a specialty pharmacy that your doctor would coordinate for you. So it's not a typical drug that you would pick up at your local CVS or Rite Aid. Now, those are the core benefits associated with the actual medical plan. Outside of that, there's a number of other great benefits as well as enhancements that make how to use the plan easier and more fruitful for you and your family. With our prescription drug benefit, we utilize a company called Express Scripts. Express Scripts is the nation's largest prescription benefit manager, which means that you have access to one of the largest networks across the U.S. You will not have an issue finding a contracted pharmacy in your neighborhood because they're contracted with all the large chains as well as a number of the smaller chains. Express Scripts also offers you a very, very user-friendly app-based system to do your mail order drugs or to initiate mail order drugs, as well as initiate a refill on your typical drugs that may require an update from your pharmacy. So we encourage all of our members to always download the app from Express Scripts to ensure that they have the simple access to refills. Behavioral health is a very important topic in today's world, so it's important that all consumers understand they have a robust network of behavioral health specialists. With Western Health, we contract with Magellan Behavioral Health Services. You do not require an authorization or referral if you're going to see a therapist of some sort or you and a loved one require one. Magellan will help you find one. Magellan will help you to coordinate any authorization that would be required. For instance, if you or a family member required an inpatient stay for any mental health reason, which can be inclusive as well of substance abuse. So Magellan is there to ensure members have privacy and have access to the doctors and the specialists that they and their family require. We also contract with Optum for their 24-hour nurse line, and it's called Nurse 24. This is in addition to your already access to the 24-hour nurse and doctors through your primary medical group. What this offers our members is an additional set of ears if they're looking for medical advice on making a smart decision for their health, whether they're not sure how to respond or they don't have their doctor information available. Nurse 24 is a free service to our members. I mentioned both of the plans that WHA offers include a chiropractic and an acupuncture benefit that's administered through Landmark Healthcare. Each plan offers up to 20 visits of both chiro and up to 20 visits of acupuncture. On the traditional plan, you're simply paying a $15 office visit copayment. You do not need to see your doctor to get a referral. You're able to self-refer to the chiropractors that are part of the network and pay your flat $15 copayment. On the high deductible plan, it is subject to your deductible, so you'll be paying the contracted rate, but it's a wonderful way to take advantage of alternative therapies that can help you avoid taking pain medicine for whatever ails you. We also include a free 24-hour, 7-day-a-week travel assistance plan called Assist America. Assist America is actually a network that works with you whether you're outside the service area by 100 miles or by thousands of miles. They will help you find the correct medical clinic setting to treat your needs. Assist America works on your behalf to have guaranteed hospital admission, to get bills forwarded back in the network since it's obvious you'll be outside of the WHA contracted area, so you want to ensure there are no billing fiascos that come up. So Assist America works on your behalf. They will also work for medical transport if you or a loved one are injured and need to be flown back into the service area so that you can be cared for by your primary medical group and their specialists. But they'll also do simple things. If you lose your baggage while you're traveling and you require a prescription override, Assist America will take care of that for you and actually coordinate the override so that you can get the prescription you need or that's in your lost baggage. There's a number of other great benefits that members can research on our website regarding Assist America. And there is no cost to our members if they utilize this service while they're out of the service area. WHA is focused on wellness, and we want to ensure that our members have the tools and the resources to take advantage of these wellness tools. By utilizing the MyWHA online system, you can access a health risk assessment, learn more about your particular health needs, as well as a library of information that can help you conquer or understand whatever your health risks are. So we encourage members to take advantage of these. In addition to these, our local medical groups like Mercy offer additional on-site classes and seminars for members that are utilizing or that have diseases that they're new to and they want to better understand how to navigate the health system and utilize the benefits to their full advantage. But ultimately, our wellness website is going to be a wonderful place for our members to start and learn more about the tools and resources that are free and available to them. MyWHA.org is going to be the main hub for everything WHA. If you are on the traditional plan, it's great for you. If you're on the HSA plan, it's critical for you. It's really important that you go on there because you'll be able to see your online accumulator of your deductible and understand what your out-of-pocket exposure has been for the year, because we don't want you to pay anything more than what the plan is written to cover. We want to ensure that you know that your bills are being forwarded in so that you're getting credit on your deductible and not just getting a bill from a provider in the mail and paying it. This is where you're going to find a source of truth to ensure that your HSA dollars or your co-payments are being applied appropriately. As well, this is a great place to research the plan that you have to better understand the benefits, search out your doctors, or if you want to change doctors or take advantage of some of our Advantage Referral Program and find another contracted specialist for a second opinion. MyWHA.org is going to be the portal of all truth for you. In addition, we offer a free mobile app that will give you all of your plan information, access to your doctor, but more importantly, each and every one of our doctor groups, or our medical groups, has a preferred app system, and for the local providers here within Mercy, you're using the InQuicker system. This system, you simply ask your doctor for a login. This will give you access to your medical record, to your lab and test results, to email your doctor, to schedule appointments, whether it's something as simple as asking for a refill or asking for an additional prescription. You can save time, save money by utilizing these free apps because you'll be able to talk to your doctor and coordinate without losing time from work and also scheduling your appointment. So as I mentioned, we are a completely local company. We know our network, we know our providers, we know where we service and the people we service. All of our employees are located here locally in Sacramento under one roof, so you're not calling a call center out of state or even further for that matter. So we encourage any members, if they're considering WHA, feel free to give us a call on our sales line or through our microsite to ensure your questions are answered accurately and you're making an educated and informed decision for your open enrollment choices. Thank you.
Right, hello there. My name's Avalon. I'm with Epic. We're the insurance broker for the employee benefits at Los Rios Community College School District. And we heard from all of the medical carriers just now, and each one of them we learned has a high deductible health plan option. Oops, other way. So I'm going to speak just briefly about the health savings account component that works in conjunction with those high deductible health plans. It's available through Basic Pacific, and it is only available to employees who are enrolled in a high deductible health plan. So as we just learned, Kaiser has a high deductible health plan on their HMO, WHA has their 1800 high deductible health plan, and Sutter Health Plus has their high deductible health plan available also. The health savings account component is technically optional, although it is one of the commonly associated, quote, perks of being in a high deductible health plan. The enrollment in the high deductible health plan makes you eligible to fund an HSA, but there are still some eligibility requirements for participating in an HSA. You cannot participate in an HSA if you are enrolled in any of the parts of Medicare. You can also not participate in an HSA if you are enrolled in anything other than a high deductible health plan. For example, if your spouse has another type of medical plan available, you can't be in both. You can only be in a high deductible health plan. Another example would be you cannot be in a flexible spending account and also in an HSA. The one of the great benefits of having a health savings account is you can fund it with pre-tax dollars. You are able to do that. It's pre-federal tax dollars, though you are still taxed by the state on your contributions to it. But you're able to use it for qualified medical, dental, and vision expenses. It's not limited just to your medical plan component. And it does roll over from year to year. Once you fund that account, it's yours, it's portable, you can take it with you if you leave the district. That money is yours and it's your account to manage. There are caps set by the IRS and the amounts that you can fund each year. For a single individual, it's $3,450, and for a family, it's $6,900. You may have seen the IRS waffled a little bit on that family contribution amount earlier this year, but they did finally settle on the $6,900 cap. If you're over age 55, you're allowed to contribute an additional $1,000 in a calendar year to, it's called a catch-up provision, and it's a one-time provision that you're able to take advantage of. The HSA funding, the premium for the high deductible health plans are typically lower than traditional HMO plans or other PPO medical plans. And because of this, the district does contribute a portion of funds to the HSA account on your behalf. It actually should say for, it's available for all three of the high deductible health plans. For employees only, they will contribute up to $100, and if you're enrolled as a family of 2 or more, it's up to $150, although adjunct faculty are not eligible for this contribution. There is a workshop if you're interested in learning more about the HSA component and how that works, that is conducted by Karen Rose. She's the account executive at Basic Pacific. It's recorded previously in the year, and it's available for you to view online at this link. You can also access this link through the Los Rios intranet website, and it is highly recommended because it really digs into the details of how the plan operates and what expenses are eligible to be used with it and what ones are not. So that concludes my portion, and next up is Delta Dental.
Good afternoon. My name is Ryan East. I'm the account manager for Delta Dental in Los Rios Community College. The Delta Dental program at Los Rios Community College is a PPO Plus Premier program. It utilizes all of our different networks and all of our providers. The PPO program allows you to go anywhere you like inside of the state of California or all other 49 states plus Puerto Rico. You have the freedom to visit any dentist you like and are not mandated that you see any particular dentist. Should you see a PPO provider, you will save the most out of pocket when you do utilize them. Covered services applicable percentages will be applied to those benefits when needed, which guarantee coinsurance levels for each member. Your program consists of 2 different calendar maximums. You receive $2,200 if you see a PPO provider, and $2,000 if you see a premier provider or non-contracted dentist. All the major benefits are set up on the incentive program that I'll discuss a little bit further on. Only prosthodontics is actually set at 50%. Now, Delta Dental actually has 3 different networks. You have a PPO network, a premier network, and a true non-contracted dentist. You can see anyone in any of these different networks anytime you like to. Over 82% of all the dentists in California participate in Delta Dental's networks. When you see an in-network dentist, a provider cannot balance bill you for anything above a contracted fee that is part of your calendar maximum. When you do see an out-of-network dentist, they can charge you whichever they like and also charge you your additional benefits that were not covered by Delta. Nothing would be written off. The incentive program works for crowns, diagnostic and preventative, and your basic procedures, where you start off at 70% your very first year, and every year that you have at least one claim goes up 10%. And in 4 years, you'll actually be at 100% of coverage for your diagnostic and preventative, your basic, and your crowns. Delta Dental has a new tool this year that we're rolling out that we're very excited about. This is a cost estimator. It helps estimate the typical cost for any procedure that Delta actually covers. The plan helps you enrollees figure out how much they're going to have to pay out of pocket, if any, when seeing a particular provider and those particular coverages that they see. In turn, makes you very informed and educated when you're out purchasing dental coverage. When you log on to Delta Dental, in the upper right-hand corner, there'll be a sign where you can click on that says Cost Estimator. Once you go into that arena, it'll list out 20 different procedures that you can choose from, and then in turn we'll pick the cost of that last provider that you saw, how much it would be out of pocket for that particular provider, and how much Delta would cover, and the next closest provider is closest to you, 5 of those. It actually is based off of the contracts, but it's only an estimate because we can't guarantee 100% what that provider will actually submit. We like to assume that the general plan will cover what you're looking for, but there's always a caveat where the provider could actually bill for something that we're not prepared for. You can also visit deltadentalins.com to look at the dental directory, benefits and eligibility, claim status for the last 5 years, our fee finder or cost estimator, and you can also print your own ID card. Thank you.
So hi, I'm Susie Polari, and I get the opportunity to share a little bit with you about your vision care coverage options. And I have a few slides that I'm going to run through, but I'll let you know in advance that anything that I'm going to share with you that's on these slides, you also have available to you through your own materials, your enrollment materials, as well as accessing all this information through VSP.com. So I will try to be brief and as straightforward as I can as to some of the options that you have for your vision care coverage. So we'll get started by just a little bit about VSP. I have had the luxury of working for the company for many years and love what we stand for. Since 1955, we have been in business to make sure that everybody's taking care of their eyes and giving you access to affordable coverage because we truly believe that when we're seeing our best, we have healthier, more productive lives. So, in choosing VSP, a couple of key reasons. Of course, it definitely, having coverage makes vision care more affordable. You will have lower out-of-pocket costs when you go in for your exam and your glasses or contacts. In addition to, as being a member, you have a lot of exclusive member extras available to you. Extra ways of saving through rebates, special offers that are all available through our network doctors. So again, we'll make sure that you go out and check out VSP.com for all of the exclusive offers that you have available to you above and beyond what your core coverage provides to you. We have a network of doctors. So for quality care, we have a network of 33,000 independent doctors. And then I know you guys also have access to a lot of our retail chain partners, Costco being an example. So that's where you go to get your comprehensive eye exams in addition to your eyewear. And again, on VSP.com, you can find a doctor who is part of your network. And you also have, which I think is exciting, is that you have the option of buying into 2 plans. You can either choose a base plan for your eye care coverage, or you can choose a premium plan. And I'll go through a few of the differences with you so that you understand what the highlights are. But I think we, especially at VSP, know that it's never one size fits all. So I'm thrilled that you guys actually have 2 plans to choose from so that you can find the one that's right for you. So on the base plan, basically you're going to get your exam every year and you're going to get lenses every year, but you will get your frame every other year. So basically what that means is you will be getting a pair of glasses every other year versus every year. And it's in lieu of contacts, meaning that you'll either choose glasses or you'll choose contacts, and it will be every other year. And then you'll have some copays that go along with each of those services. I'm not going to get into all of the copays and the differences because, again, it's going to be in your open enrollment materials and available to you either through VSP.com or you can always call our customer care center. I can't say enough about them. So if you ever have the opportunity to call them, I know you'll get amazing service. So again, let's go ahead and I think just talk real quickly then about your buy-up plan and what the differences are. Primary differences, you will get a pair of glasses or contacts every year. And then in addition to that, you will have slightly higher allowances for like your frame. So you'll get a little bit more money to apply towards your frame. And I think the other thing that is a great benefit as part of this plan is that progressive lenses. So the lenses that allow you to see in varying distance, you can read and see far in a blended lens, is also covered under this plan. So it's something to definitely take advantage of if you're someone who wants to get a pair of glasses every year and take advantage of some of the better technology that's available for those progressive lenses. This would be a great plan and something that you should consider. And providers, we touched upon that, so you have a great network of doctors available to you. Independent doctors in addition to some retail chains. And the best way to find out how to see an in-network doctor, which I highly recommend because you will get the most out of your coverage when you see a network doctor, is to go to VSP.com and we have a Find a Doctor tool that's out there. And it's very easy to use and it'll give you a great listing of all of the doctors and locations that are closest to you. Here's just a sample of some of the retail chain partners that you also have available as part of your network option. If you choose not to see an independent doctor, you can also choose any one of these retail chains that happens to be in your area. And using your benefits, I think this is where I'm at an advantage talking about vision care. It's simple and it needs to be simple. You have plenty to worry about when it comes to medical and some of your other more complicated big decisions. Vision care is affordable and simple, and really all you need to do is just pick the plan that you want to enroll in, and then I encourage you to go to VSP.com and register so that you can see all your personalized benefits information and your network of doctors. And then make sure that you get your annual exam and your eyewear, and that's really about it. It is that simple. And again, we're always here for you. So customer service as well as VSP.com as your resources. So thank you very much.
Hi, my name is Julie Marsh, and I'm a benefits counselor with Unum. And today we're just going to touch on a few of the offering benefits through Unum. I'm going to start off looking at long-term disability insurance. What that is if you are sick or injured and you are unable to work, you're completely disabled, totally disabled, which is prescribed by a physician, you would be eligible for coverage on this once you have fulfilled a 90-day elimination period. So that's similar to your deductible on your car. You pay the first $500 and then they pay after that. With long-term disability, you pay the first 90 days and then Unum would begin paying 66.67% of your gross income monthly. You get paid once a month with this one. The maximum benefit on that would be $12,000. The maximum duration on the long-term disability is 2 years to your age of retirement. So 62 years at this time is the age of retirement. That can change along the way. The definition of a disability is totally disabled, and it can be a mental disability. The limitation on the mental disability would be 2 years. They do not extend that further. On the other total disability for sickness or injury, you can go longer than 2 years, but at the 2-year point, they're going to revisit whether or not you're able to do any form of work that you're qualified for. The next thing you're going to look at is the basic life insurance. So Los Rios Community College District provides basic life insurance for its employees. You have a $50,000 life insurance coverage, and you have a $50,000 accidental death and dismemberment coverage. meaning if you die for any reason, sickness or injury, Unum pays the $50,000 benefit. If you die in an accident, they double the benefit and pay an additional $50,000 benefit. Now, the dismemberment portion of the accidental death and dismemberment means that if you lose your eyesight due to an accident, you lose your hearing due to an accident, you would become dismembered due to an accident, you would want to contact Unum and see if that is a covered event. Conversion. If you leave the company and you would like to convert this, it would be converted to a whole life, and you would contact Unum Direct if you'd like to do that, if you're leaving. And the living benefit means that if you are told by a doctor that you have less than a year to live, you are eligible to cash in basically a percentage of your plan, and you can collect that monies right away before you pass away. The remainder of it would be collected, would go to your beneficiary. The voluntary life accidental death and dismemberment is another option for you and your spouse and your children, also available to the spouse, domestic partner, or children. What that is that you can purchase life insurance additional to what the company provides on your own. So if you look at the screen, you'll notice there are different amounts up there. What that means is that as we age, if your birthday has a 5 or a 0 at the end, each 5 years, your premiums go up. When you're very, very young, the premiums are very, very low. As we get further towards retirement, the premiums increase every 5 years. You can elect up to 5 times your salary with a maximum of $750,000, and $250,000 of that on your initial offering would be guaranteed issue. What guaranteed issue means is that you do not have any medical questions and there is no medical qualifications. For your spouse, you can elect up to $150,000 maximum. So if you would get $100,000, your spouse can also get $100,000. They cannot elect an amount above you. You cannot elect an amount above yours for them. You can also get coverage for your children up to $10,000, and it's about $120, and that includes all of your children from age 6 months to 26 years. At 26 years, they would age off the plan, and you have the option to get them a whole life policy at that time with no medical questions asked. Voluntary long-term care is used if you cannot perform 2 of the 6 activities of daily living, or you have a cognitive impairment. Activities of living such as dressing, feeding yourself, transferring yourself, getting from one place to the next, getting out of bed, dressing yourself. So if you cannot do 2 out of those 6 activities of daily living and cognitive impairment, you would be eligible to get long-term care if you purchase this plan. The different benefits on this are 2 years, 5 years, and lifetime duration, and you can get $3,000 to $9,000 per month in coverage. That would be the maximum that Unum would pay for care in a facility. If you had care in your home and you elect that the option of a family member, to be able to care for you, you can get up to half of that. And if you're in assisted living, if you're in a full-blown facility, those numbers vary depending on the type of facility you're in and the care that you're getting. There is an inflation, 5% simple inflation option, which you can elect at the time that you enroll. That just means that your coverage is going to go up 5% per year from the beginning amount. There is a 90-day elimination period, and again, 90-day elimination period simply means for the first 90 days, the plan doesn't pay, but beyond the 90 days, it starts to pay with the maximum monthly that you've chosen in your plan. You can get this, you can opt for your spouse to get this, you can get it for parents, you can get it for grandparents, siblings, and adult children. Value-added services, which you also have if you enroll in one of these plans. One is the EAP service, which you also have another plan for that. Unum would provide this with your current plans, so you could double up. So if you have 5 counseling sessions you can get with the EAP that you have through the company, Unum will also provide counseling sessions, and that is on a needs basis. The Worldwide Travel Assistance is there through Assist America, and that is if you are traveling more than 100 miles outside of your home, you would be eligible to receive benefits from them if you forget your prescriptions, if you lose a passport, if you lose luggage, if you need medical care when you're outside of the country and you don't speak the language. All of these things you can have access through Worldwide Emergency Travel Assistance. You would be able to call a number and get assistance with any of these things. And just remember, this is not a reimbursed type of situation. This is as needed. So you would call them first and they would provide help for you in any given situation. Thank you for being here. Thank you for accessing that, and have a nice day.
Hi, my name is Monica Andrade, and I'm an account manager with MHN to talk about your Employee Assistance Program, which is also known as your EAP. So one of the great benefits with the EAP is that it's at no cost to you as an employee. So Los Rios is actually the one that pays for the benefit, okay? The other neat thing about the benefit is that it's a household usage, meaning anyone that lives with you, regardless of age or relationship, can also use the services. So if you have mom and dad living with you, or maybe you live with the roommate, as long as they're in the same household, they can also use the services. Really simple to use before we dive into the benefits. So when you call the 800 number, you would identify yourself as a Los Rios employee. But let's say somebody else other than yourself were to call in that lives in the home with you. All they would have to say is that they live with you, that you work for Los Rios Community College, and they would be able to access the benefits. It's completely confidential, so that's one of the stigmas that we do have. If Los Rios is paying for it, what is it that they're finding out? We only provide a utilization report that shows percentage of the employees that are using it, as well as what type of services, okay? You're protected by state and federal, so we don't release names and what you're using it for. We're available 24/7, so at any time, if you need to speak to somebody immediately because you're in the middle of a crisis or you just want to talk to somebody, we have licensed clinicians that you can definitely speak to, while we're also looking for a therapist to see in person if that's the route that you would like to go. There's 3 ways that you can actually access a therapist. You can do it in person, so you would give us the zip code and the preference of area that you would like, and we would refer you out to a contracted provider. Or you can also do telephonic counseling or via the web. You have 5 sessions per incident with the therapist. So that means, let's say I go see a therapist for stress. That's 5 sessions. And then a couple of months down the road, now somebody passes away in my family, I'm dealing with grief. Well, that's considered a different incident, so you get another 5, okay? Here are some of just the examples that we can help you with. So it's marriage, counseling, family, stress, okay? So the other thing that people remember when they hear the EAP is that it's a mental health benefit, which is one of the resources that we do provide, but we also provide work-life services, okay? One of them is childcare and elder care resources. So let's say I have children ages 5 and 8, and I need to find a daycare facility or a preschool near my home, we will go ahead and provide a confirmed resource. So if you're looking for a daycare facility that's open from 6 a.m. to 6 p.m. and will take both your children and they have openings, we'll do the legwork for you and we'll provide that referral. Same thing with elder care resources. So since MHN is nationwide, your parents or somebody elderly that you're caring for, let's say you're trying to look for a convalescent home or a skilled nursing facility, not just in California, but maybe they live in Arizona, we can provide that resource. Or another example, if you need somebody to come and clean the home or Meals on Wheels, we have different resources that you're able to access as well. The financial services, if you're having problems with credit issues, you're planning on retiring, you want to know what a 401k is, we won't advise where to dip in your money, but at least we can give you an explanation on what that is. We have financial advisors as well. We also have our legal services. This is available to you for 30 minutes consultation over the phone or in person. And the reason it's either or, it's because it really depends on you and the attorney if the consultation can be done over the phone, or maybe there's some paperwork that you have questions on you're not sure about. It might be better if you go in the office. It's really up to you and the attorney as well. After that 30-minute consultation, if you need to obtain the attorney, you get a 25% discount through MHN. But just to seek legal advice, it's completely free. One of the things that I do advise the members, if you are seeking legal assistance, there's a lot of information that we have online. So at the end of the presentation, you will see our website and your web access code. We have a legal section on there where we have legal forms, how to do a will, and a lot of other legal information that you would like to go ahead and access, so that way you can probably just do a little bit more of your homework, not to steer you away from calling, but that way you might get more knowledge that you probably didn't know, so you can make good use of those 30 minutes. The other thing that we have is identity theft. So you don't have to wait for it to happen to you. If you want to make sure that you're securing every area to prevent it from happening to you, we have identity theft specialists. But let's say that it does happen to you. Obviously, the first thing that happens, we're stressed out, we probably can't think. We can help you recover your identity back. So we'll go ahead and tell you what 3 credit bureaus you need to contact, other resources to make sure you cover all your areas, and that way you can also prevent it from happening to you again. Our daily living, the best way I can put it is like your concierge service. So if you're looking for a party planner, or you're doing a party and you need somebody to rent the chairs, or a food caterer, or you're traveling on the road and you want to find hotels that take pets, maybe you're traveling with your animal, we can provide that resource to you. So that's why I always say the daily living is like a concierge service, like Google, okay? The other thing that we have embedded is your wellness coaching program. So the wellness coaching program, we can provide, it's telephonic only, it's not in person, but if you want to learn how to deal with stress, we have a stress management program. If you're looking to lose weight or eat better, we have menus online that our wellness coaches will help you navigate through, but we also have a wellness diary where you can keep track of that, okay? We also have, if you're living with the chronic conditions, so if you have asthma or diabetes and you need to learn how to manage it, we can also provide that to you as well. We have a smoking cessation through our wellness coaching, which is really good. That can give you a lot of information on how to quit smoking. This is our website. We also have a search engine on there. So at any time, if you're trying to look for a certain article or a certain topic, if you type that on the right top of the page, you'll be able to find all the resources. The 800 number, like I said, is available 24/7. And again, it's at no cost to you. And remember that it's a household benefit. Thank you.
Okay, hello everybody. This is Nicole Keller, Employee Benefits Supervisor with Los Rios, here to wrap things up for you today. I wanted to provide you with a number of resources that you can use to access some of the forms and benefits that you have available to you as a Los Rios employee. For online resources, the best place to begin would be our employee benefits website. Here you can access open enrollment memos, guides, recorded presentations such as this one, etc. Through there, you can also access forms, which is the next link on the PowerPoint. We strive to essentially put all of our forms on our website. So there you can find enrollment change forms, cancellation forms, waiver forms, etc. We also house all of the carrier phone numbers and websites. In addition, there's a really wonderful resource available to you via the My Benefits website, which is hosted by our broker, Epic. I will show an example of that in just a moment, but you can compare plans that you may be considering enrolling in, and it's a great resource available to you. For adjunct faculty, there's also a premium calculator. So you can take your FTE and plug it in and determine what your monthly or tenthly premium would be. So the My Benefits website that I just mentioned is shown here. You can actually side by side compare the plans that you're interested in enrolling in across various features of the plan. For example, whether or not there's a deductible and what that may be, what the out-of-pocket max is, etc. So I strongly encourage, if you are considering between various plans, to take a look at that, place those plans side by side, and make all the comparisons for what's best for you and your family. And so just to conclude, due dates. As I mentioned before, open enrollment closes on Friday, May 25th at 5:00 p.m. Original forms must be received in our office by that time. We cannot accept postmarks after that date, placement in campus mail, emails, or faxes. None of those methods qualify. Unfortunately, the original forms have to be in our office by that 5:00 p.m. deadline date, or your next opportunity to enroll would be an open enrollment in spring of next year, unless, of course, you experience a mid-year qualifying event. Paperwork is required of all employees who are planning to make a change during this enrollment period. As I mentioned earlier, if you are not making a change, then you don't need to submit paperwork. However, it's a very good idea to review the employee benefit guide for any plan changes that may impact you. New hires, their due dates are all paperwork. Benefits-related paperwork is due within 31 days of hire. That's the same for any sort of mid-year qualifying event that you may experience. And then for adjunct faculty, the deadlines for the upcoming academic year are 5:00 p.m. on August 23rd, as well as on 5:00 p.m. on February 11th of next year of 2019. I thank you very much for tuning in today. And if you have any questions, please feel free to contact the Employee Benefits Department. You can do so by telephone or by email. Thank you again for participating.